Dental implants are probably the best thing that dentistry has come up with at this day and age of replacing natural missing teeth. It is a titanium threaded cylinder that gets placed into the bone that anchors either crowns or bridges or dentures, and it becomes a part of you, and it is integrated just like new hips and knees and other prosthetic parts. We are able to anchor dentistry to that is functional and aesthetic and very, very long lasting. Implants have the longest statistical longevity of any of the restorations that I can do, and they really afford patients the function and the looks that they're missing when they lose natural teeth. Bone loss that occurs after a tooth is missing is what really is the limiting factor right now in implant dentistry. So it's very important for patients to move forward after they lose a tooth to replace that with an implant, as that holds the bone around. The bone needs the stimulation of either a natural root of a tooth or the implant in order to stay around. And if that is lost for too long a period of time, it is much harder to recoup that bone and be able to place the implant solidly in something that will hold it. And most of the research these days is going into bone grafting and how to regrow that bone in order to make patients better candidates for implants. One thing patients don't realize is that the cost of replacing their missing teeth with implants can rise the longer they wait, because the bone loss is a steady process that occurs without that stimulation of the bone. And if they wait too long, then over time they have to get more involved bone grafting procedures that end up lengthening their treatment and increasing their costs. So it's important that when they lose natural teeth for various reasons, that we move forward with doing implant work to preserve that bone. Because once it's lost, it's very hard to regain that bone. It's very interesting. Early on, when I first started doing a lot of implants, I was not familiar with the surgical procedure, because that's something that we don't do in our office. And I wanted to get to know my surgeon and see the type of work that he did. So I actually had a family member, my sister-in-law, who needed an implant. And she was very concerned. She's a bit dental phobic, and I ended up accompanying her to the surgery appointment. And she had sedation during that appointment, and she was very worried about the pain and discomfort and the surgical procedure. And basically what ended up happening is she had her tooth, she was sedated, she had her tooth extracted, she had an immediate implant placed in the socket, and we were wrapping it up, and they took her off the sedation, and she woke up and looked around and said, what's everybody doing? Let's get going. And I said, look at your watch. And she went, oh, 2 hours had passed. And she had no idea. She had her implant done. It was a very successful case. And she left and went back to where she lives, a couple hours away. And the next morning she called me and said, oh my God, I forgot to take my pain pill. Is that okay? And I said, well, does it hurt? And she said, no, not really. And I said, then you're fine. And I have to say, most of my patients experience that very similar experience, that the entry point of the implant into the gum tissue can be a little sore, but the actual placement inside the jawbone there's no nerves in the bone tissue, so it doesn't really stimulate a lot of discomfort. And most of the time patients take very, very little analgesics after an implant procedure, if any. The impact that implants have in patients' lives is tremendous. They realize that they have the functionality and the strength and the permanent type of solution that they were given when they had their natural teeth. And they just really replicate all the parameters of a natural tooth. They are strong, they function well, they look good, they stay in there all the time. It's not something that comes in and out. They're able to clean them as though they're their own natural teeth. And for the most part, they put these in and forget about them, and they work just like they had their own natural teeth. When patients have dentures, one of the kind of things that they really have problems with is the stability of them. They rest on soft tissue that's squishy and moves around, and they just have trouble chewing foods that they like, and they slide around, and they have the embarrassment of them dropping if they are talking, and they don't have enough saliva in their mouth, and adhesives are messy. And what we can do for dentures is we can place a few implants, have them with attachments on them that attach inside the denture, and the denture basically snaps in place and creates a very stable base for that denture, so it doesn't slide around, they don't have to use adhesive, and it actually keeps the bone around, because the pressure of a denture on the ridge of bone resorbs it, and it melts away over time. And somebody who's been wearing dentures for 20 or 30 years doesn't have a lot of bone left. It really just gets dissolved, and their dentures keep getting taller and taller and taller. And when we put implants in there, that really stimulates the bone, keeps the bone around, and they stop the bone loss, and the dentures become very secure, and they're attached to the implants, and they don't move around, and they really get the confidence back to chew corn on the cob and bite into things that they never could bite into before, and they don't fall down when they are talking, and it really makes the dentures as secure as possible. And in many cases, I actually continue with the same exact denture that they have. We're able to put these attachments inside the denture that they currently have, and affix it that way, and it really makes it much more secure than previously. In my practice, I don't promote mini implants very often unless it is to support a temporary situation. And I think that what some practitioners are doing with putting crowns on the same day on a couple of mini implants is unhygienic, and it's not predictable, and it ends up creating a lot of problems, because patients think these are permanent like a real implant, and they are not. And if you look at the actual piece, the mini implant is like a tiny thin little nail and requires very little surgery, and the regular implant is like a bolt. It's much more substantial, and is something that has statistics that they're around for 30 plus years, and mini implants do not have that kind of longevity. The wonderful thing about implants is that you can really regain the function and the confidence that you used to have with natural teeth. They are so strong and functional that patients can go right back to eating the foods that they like. They don't have the embarrassment of loose dentures. They don't have the missing space that you can see when they smile. They really replace their natural missing teeth. It is the best thing that we've come up with to replace natural missing teeth. With an implant, you can floss in between it in many cases, and it feels like a natural tooth, and you brush it like a natural tooth, and it stays in there permanently, and it's not something that they really notice any difference with when they're taking care of themselves. Most patients who get the procedure done wish they didn't wait, because it really gives them their life back, gives them their function back, gives them their aesthetic smile back.